Welcome back. Brayton is off traveling, so I'll be the one who's talking to you for the next Fuse month instead of Brayton. Today we are tackling the single most common joint disease in the world, osteoarthritis, OA. If you go to a general doctor with knee pain, they might tell you, "Oh, it's just wear and tear. You're getting older. It's like a car tire that has run too many miles." I want you to delete that image from your mind. According to the Arthritis Foundation and recent research from Mayo Clinic, osteoarthritis is not just a passive wear and tear. It is an active disease process. Your body isn't just wearing out, it's failing to repair itself. It involves inflammation, the breakdown of cartilage, and structural changes to the bone itself. Thinking of it as just old age is dangerous because it makes you feel helpless. But as we will discuss today, you're not helpless. To understand the pain, you have to visualize the joint. Imagine your knee. The ends of your leg bones are covered in a white, slippery tissue called cartilage. This acts like a shock absorber and a slippery coating, allowing bones to glide over each other with zero friction. In osteoarthritis, this cartilage creates enzymes that essentially eat itself. It becomes rough, cracks, and eventually wears away completely. But here is the part most people miss. Bone spurs, osteophytes. The Cleveland Clinic explains that when the body senses the cartilage is gone, it panics. It tries to stabilize the joint by growing new bone at the edges. These are called bone spurs. These jagged little edges rub against your soft tissue, causing that sharp stabbing pain you feel. So, why did you get it? Is it genetic? Sometimes. But the two biggest drivers are weight and history of injury. Let's talk about weight first, because this statistic from Johns Hopkins medicine is mind-blowing. For every 1 pound of extra body weight you carry, you add 4 pounds of pressure to your knees. Think about that. If you are 10 pounds overweight, that is 40 pounds of extra crushing force on your knees with every single step. Over 10 years, that is millions of pounds of extra mechanical stress. This is why obesity is the #1 preventable cause of OA. The second cause is injury. Did you play soccer in high school and tear your ACL? Did you have a meniscus surgery 20 years ago? The CDC notes that a major injury increases your risk of developing arthritis in that joint by 7 times later in life. How do you know if you have osteoarthritis versus rheumatoid arthritis? There are 3 distinct signs to look for. 1. Mechanical pain. OA pain gets worse with use. If you walk all day, it hurts more at night. If you rest, it feels better. This is the opposite of inflammatory arthritis, which often feels better once you start moving. 2. Morning stiffness, the 30-minute rule. According to the American College of Rheumatology, OA stiffness usually clears up quickly, typically within 30 minutes of waking up. If your stiffness lasts for hours, that is likely rheumatoid arthritis, not OA. 3. Crepitus, the noise. Do your knees sound like Rice Krispies? That popping, grinding, or grating sensation you feel when you stand up is called crepitus. It is literally the sound of bone rubbing against rough cartilage. Now let's talk about how to fix the pain. Most people reach for painkillers immediately, but you need to be careful. According to the American Academy of Orthopaedic Surgeons, the first line of defense is often acetaminophen, Tylenol. It is safer for your stomach, but high doses can damage your liver. If that doesn't work, doctors move to NSAIDs like ibuprofen or naproxen. These are better at stopping inflammation, but Mayo Clinic warns that long-term use can cause stomach ulcers and kidney problems. A safer alternative? Topical NSAIDs like Voltaren gel. You rub it directly on the knee. It absorbs into the joint without destroying your stomach. If pills fail, we look at injections. 1. Corticosteroids. These are powerful anti-inflammatory shots. They kill pain fast, but they are a temporary fix. In fact, a study published in Radiology suggests that getting steroid shots too often might actually speed up cartilage loss. 2. Hyaluronic acid, gel injections. This is different. It acts like a lubricant, replacing the natural fluid in your knee. It doesn't work for everyone, but for some, it buys 6 months of relief. Here is the most important thing I will say today. When your joints hurt, your instinct is to stop moving. You want to sit on the couch. Don't do that. The Arthritis Foundation uses the phrase, "Motion is lotion." Here is the science. Your cartilage does not have a blood supply. It doesn't get nutrients from arteries like your muscles do. It only gets nutrients from the synovial fluid inside the joint. The only way to push that nutritious fluid into the cartilage is through compression and decompression, aka movement. If you don't move, your cartilage starves and dries out. But you must choose the right movement. Running on concrete? Bad idea. You need low-impact exercise. Swimming, cycling, or elliptical machines. These get the fluid moving without pounding the bone. Also, strengthening your quadriceps, thigh muscles, takes the pressure off the knee joint. Finally, let's talk about supplements. Everyone asks me about glucosamine and chondroitin. Do they work? The answer is mixed. The National Institutes of Health conducted a massive study called the GATE trial. They found that for most people with mild pain, these supplements did not work better than a placebo, sugar pill. However, for a small group of people with moderate to severe pain, they did see some relief. So, what is the verdict? It is generally safe to try. Take it for 3 months. If you feel better, keep taking it. If you don't feel a difference, stop wasting your money. But remember, no pill can fix a bad diet. Eating anti-inflammatory foods like omega-3 rich fish, berries, and leafy greens is scientifically proven to lower inflammation in the entire body. To wrap up this masterclass, osteoarthritis is not a death sentence for your active life. Yes, your cartilage might be thinner. Yes, you might have bone spurs, but pain is not inevitable. 1. Manage your weight. Remember, 1 pound lost, Drucker 4 pounds less pressure. 2. Keep moving. Motion is lotion. 3. Use medication wisely to manage flare-ups, not to mask the pain forever. You're in control of your joints. Do not let the diagnosis stop you. I'll see you in the next episode.